take us inside how this approach, certified community behavioral health clinics, how did this get started and why?
This is really the next evolution beyond behavioral health homes, the next step into a more advanced payment system and a more advanced array. What is a certified community behavioral health center? It is a standard definition of what it is to be a community mental health center. This is the first time we've had a standard definition in federal regs since 1980. So you know what you're getting. It's defined in 114 certification criteria. It's a comprehensive array of services because many people we serve have multiple needs. They have substance use disorder, they have mental illness, they have physical health needs, and these are all required to be attended to and to see that people get the care they need in the certification standards. It is a payment mechanism that is sufficient to pay the actual cost. You know, with traditional fee-for-service, I can guarantee you one thing. There are some people you're overpaying and there's some people you're underpaying because the costs in Annapolis are not the same as the costs of delivering care in Cumberland.
Amen.
So this is data-driven care. Both the finance is data-driven because it's based on an individual detailed line-by-line cost report. So you know what you're buying, and the providers can compare against each other what it's costing them, and then they get better. They become better business people, they know their business better, and they learn from each other because of the standard cost report. It is data-driven because there are over 24 performance measures. Accountability is by how good the outcomes are, not just by counting how many units of service. Better accountability than in fee-for-service. But those standards are what really make it. You get increased access. You have to have weekend hours. You have to have prompt access. 50% see people the same day they show up. You talked about 988, and it's great to have an access point. But an access point is no good unless there's treatment standing behind it. Otherwise, you're just waiting for the next crisis. But to get that crisis system, CCBHCs have to have mobile crisis. They have to have 24/7 hotlines. They have to have urgent prompt access to care. They are actually a way of reducing the load on your 988 system because when people can get in promptly, they don't end up having a crisis and calling 988. It is full age range of service, adult to elderly, includes veterans. It is a comprehensive array for a wide number of people. And the big thing we've seen it do nationally is increase access. 25% more people getting access to service, and that's what everybody's struggling with nationally. You're not the only one. It's the waiting lists. Any waiting list for service is a waiting list for another crisis. So that's CCBHC. Standardized evidence-based services that are comprehensive, data-driven accountability that improves financial business ability and improves clinical ability.